County Health Department, lead education and lead outreach and education coordinator for the health department, Rhonda Rudolph. Hi, Rhonda.
Hi, how are you doing, Bart?
I'm good. Good to see you
Good
back.
to be back.
Rhonda, we think about the first time you were on the show 20 years ago.
Oh, it's been over that.
21, 22.
It's been a while.
It's been, but Rhonda used to talk about the dangers of smoking.
Mm-hmm.
And over the years, you've dealt with a lot of health, community health issues. And lead, it's a big problem, as we know, with other communities like Benton Harbor and Flint.
Oh, yeah, definitely.
Yeah. So today, I want to give everyone a heads up. Rhonda's going to share some information about lead. And at the end of our visit, we are going to ask a question. And it's a chance for you to call in and win this giant bucket of cleaning supplies that Rhonda brought today. All right.
Absolutely. So, Bart, next week, as I alluded to earlier, is National Lead Poisoning Prevention Week. Mm-hmm. So it's actually celebrated usually the last week in October every year. And it's a time for us to get a theme out. And this year it's got 3 themes. It's get the facts, get your child tested, and get your home tested. Mm-hmm. And so we're focusing on those different themes in a variety of different ways. We want to, and you're helping us, by the way, we want parents to understand what lead is, really. Now, everybody kind of may have an idea that, yeah, lead's a poison, lead is a metal, but do they really have a good idea about what lead does in the system? Number one, lead does not belong in the body. It is not an ADA certified nutrient. So if lead is in the system, it is actually replacing an ADA substance. So if you've got lead in the body, it can replace iron, it can replace calcium, and it can replace vitamin C, which is why those things are important, because if you're getting a good diet that is high in vitamin C and iron and calcium, if you do get exposed to lead, it can help wash those, or it can help dilute and take care and expel that out of your system.
So a healthy diet is...
A healthy diet is crucial for especially a young child. And that's why we focus on young children, because their bodies are so small. So if you were exposed to the same amount of lead as, say, a 2-year-old or a 3-year-old, that 3-year-old would be more affected than you would, because it's all about saturation level, and that child would have a much more difficult time. So nutrition is a big part of it. The sources are a big part of it. We know that household dust from the breakdown of the lead paint, and when we're talking about lead paint, we're talking about paint in homes before 1978, because that's when all lead paint was banned from future sales. Mm-hmm. But we know just because it was banned doesn't mean it's not out there. Homes were painted with it. Lead was added to paint to make it a durable paint. It made it shiny and glossy, and it made it last longer. So we know there are homes out there with lead paint on them.
Can you tell just from looking at a wall in a house if it's a lead?
Not really, no, you can't. Sometimes you may say, oh, it's a little bit shinier, or it cracks different, but you really, and I was looking at your, excuse me, but I was looking at some of the paint you had in the front area and just thinking about that a while ago. No, you cannot tell, and that's why it's important. If you're concerned, you can get your home tested. Mm-hmm. But lead can actually come through many other layers of paint, and it can break down and come through those different layers of paint, and then you end up with lead dust.
Oh, wow. Can it go through Kills paint?
From what I've heard, yes and no. I mean, I've heard different sources, but the best thing to do is a plastinated type paint where they say it's lead safe, and it's kind of got a really thick texture. It's like a plastic coating. Mm-hmm. That is considered the most lead safe.
Okay.
And I don't think Kills is that way.
All right, so lead paint and lead pipes. Those are the two things Are there others?
That's the most typical ones you hear, the water with the soldering and things like that. And I know the city is doing a big project right now with
Okay.
replacing service lines. There's also, some people have hobbies where they may deal with lead.
Soldering?
Soldering like lead with the lead glass paint. You know, if you're putting lead paint or lead glass together. Fishing or hunting, especially with hunting coming up,
Oh,
you know, with the deer season and stuff. A lot of people use lead in the ammo. So making sure adults, if they're using leaded ammo, to use gloves and to make sure they're using it away from the children. How many adults have lead sinkers in their fishing tackle and don't even think about it?
no, you never do. All right, let's talk. You mentioned lead dust, so we want to know how we clean, and you brought cleaning supplies. So you brought some charts, Rhonda.
Right.
There are ways that you can
So
minimize.
this is what we call the safe cleaning of lead paint and chips. And the whole point about safe cleaning is we don't want it to become airborne. So we want to keep it moist. And so you wet it down and you wipe it. And when you're wiping it, and that's why we put paper towels and disposable wet wipes, because you don't want to wring it out and then put it in your water supply. You want to wring it, you want to use paper towels and stuff you can throw away. We want you to use gloves because we don't want you to get it on your hands. So we've got all those different things. We've got Swiffer mops because we want you to tear it off and throw it away. Duct tape. We put duct tape in there because if you've got cracking, peeling paint, lead has a sweet taste for kids. So if there's cracking, peeling paint and they find it and they peel off a piece and stick it in their mouth, they're going to think it's sweet tasting. So they're going to keep going back to it.
Oh, okay.
So you can put duct tape over a cracking, peeling piece of paint or in window sills where it may be cracking or peeling. But yeah, you want to keep it moist and wet so it doesn't become airborne and then you inhale it. Because when you inhale it, it can do damage to your lungs and then get in your bloodstream, and that's where it can become really hazardous.
All right, next slide.
Okay, this slide is really good because it has the assessment in the blue box. It talks about who is most at risk, and you can see if you have a home that's built before 1978. And you know, a lot of people, the older homes are beautiful and they have character and stuff like that, but you have to be really careful when you start renovating an older home. It's good to use someone that's certified in RRP or certified to do contract work. Now, RRP is renovate, repair, and paint. So you want to make sure that they know what they're doing. And renovate, repair, and paint does not mean that they're completely eliminating the lead, but they're doing remodeling in a safe method. They may close off a room so that people don't have access to that room while they're renovating that room. Now, if they were supposed to do a lead abatement, usually lead abatement involves people moving out of the home and completely redoing the house.
The way the asbestos abatement.
Yeah.
All
So
right,
maybe new windows, new doors, the whole kit and caboodle.
so there's this box on this flyer that says children should be tested at 1 and 2 years. So is there like a safe level of lead?
Yes.
Okay.
3.5 is the current blood lead reference value
Okay.
for all children, and it was just lowered in May for Michigan. Now, the CDC lowered it in October of 2021, but Michigan Medicaid policy was lowered May of 2022 because that's when doctors, nurses, practitioners, social workers, whoever's providing services for anybody with Medicaid, they can actually go out and provide services for someone at that 3.5 level. And that's based on the 97.5 percentile of the NHANES survey.
All right, we're going to give this bucket of cleaning supplies away right now
Okay.
to the first caller at 787-8817 who can tell us the current blood level reference value for the testing for the children. And Rhonda said it a few times in the last couple of minutes. What is that number, something point something, 787-8817. All right, Trish will take the calls, and we've got another couple of slides we want to take a look at, keeping people safe from lead poisoning. Other things besides the paint and cleaning. What about lead pipes? What if you have lead pipes? What do you do?
Well, lead pipes, with lead pipes, it's interesting because anytime we're dealing with people with lead water and stuff, we don't recommend they use hot water because hot water can pull lead out of the pipes if they have it present. We encourage people to use cold water, but also to let the water run for like a minute to flush anything that may have gotten into that water. So that's a biggie. Let your water run, especially if it's been sitting for more than 6 hours. Let that water run. Let it get fresh water and then use it. That includes even if you're making baby bottles and stuff like that with it, cooking, anything. Boiling water does not take the lead out.
No.
It's still there. So you want to let the water run and get fresh water. One of the things we're trying to do right now is work with physicians because we also talked about not only with the home and getting the facts about lead, but getting your child tested. So we're working with physicians in the area to make sure they understand the importance of testing children. We've seen the levels of blood testing go down, really down since 2019.
The levels of number of people being
The number
tested?
of children being tested for blood lead since 2019 has really gone down.
Well, the pandemic probably caused a lot of that.
The
People have-
pandemic,
yeah.
and we also had a recall on lead Care 2 machines, which a lot of people use in their office. It's a portable machine that does lead testing, and there was a recall on some of the testing kits.
No.
So that put a real, it delayed a
Dent.
lot of testing, let's say.
All right.
So we're hoping to get those numbers back up, but even now, the recall was lifted back in February. So even with that recall being lifted, we're still not seeing those numbers come back up the way we want them to see. So we're hoping to work with physicians and nurses and clinics and stuff to get those numbers back up where we want to see them.
All right, so how does someone get their child tested? The doctor's offices?
Doctors can test. Now, if they're a WIC client, they can get it tested in the WIC clinic. If a parent is not sure if their child has been tested, they can call the immunization clinic, or they need to visit the immunization clinic or check with their doctor. When they look up their immunization records on the Michigan Care Improvement Registry, there's a tab that can tell them if their child has ever been tested for lead. So some people are not aware that they can check to see if their child's ever been tested for lead.
How about that? Does it go in my chart or any other place?
I think it does if the doctor has put it on my chart.
Right.
But Michigan Care Improvement Registry is another way that they can check. But my chart would have it on there if the doctor put it on there. Most of them are good at doing that.
Good.
So yeah, most, but if they had it tested, say if they lived in another county
Right.
and didn't get the records in my chart, MICR would have, as we call them, Michigan Care Improvement Registry.
Well, Rhonda, I'm glad we have our health department concerned on the dangers of lead among our children and that there's so many resources. Thanks for all that you offer, and thanks for being here.
We do have another resource that we can provide to agencies and health professionals and clinics. If anybody's interested, we have a healthcare provider toolkit, which they can call me at 768-2131, and I'd be happy to send this beautiful provider toolkit out to them with all the resources that they need in one handy dandy little toolkit, and it's all that they need.
Perfect. And
Yes.
I got to compliment you on your outfit today. Very
I've
seasonal.
got my October orange.
Yeah, I like it.
Thank you.
It was great to see you again. Thank
Good
you.
seeing you. Thank you.
Rhonda Rudolph is Lead Education and Outreach Coordinator at the Jackson County Health Department. Up next,